And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. Autism, something that is getting talked about more and more. So is this something that we're going to see maybe a cure for, or not necessarily?
I mean, we're always looking for a cure. I mean, a lot of people claim that we don't cure anything anymore.
Just keep it ongoing.
Yeah, we just keep it chronic and ongoing, but they're always looking for a cure, obviously. You know, every disease really doesn't get its fair share, you know, heart disease, breast cancer, etc. That gets a lot of research dollars, a lot of attention. And autism certainly seems like it's getting on that level where it's getting a lot of attention, a lot of research dollars. And typically when you get to that point, you get some treatments, you get a lot of therapy, get a lot of attention to it. And certainly if you can't cure it, you can certainly treat it very aggressively and live a normal lifestyle, which is a lot of our goals. A lot of times with chronic illnesses like diabetes or heart disease, a lot of medicines come out, a lot of procedures, and patients can live longer and still be able to function. Maybe that is the goal of autism, but there's always conversation about stem cell research and what it can do, and so medical research is always ongoing, and there's always cures around the corner and breakthroughs, so we'll just have to see how it turns out in the future.
Okay, on to some of our viewers' medical questions. This person wants to know, do older people still have immunity to the measles if they had the measles or had the vaccination more than 40 years ago?
I think anytime you get older, a lot of times your immune system will begin to wane, which is when we talk about getting booster immunization. So I had this conversation with a patient in my office today because there was some concern about a measles outbreak somewhere and 4 people got infected. And so I haven't read a whole lot about that, but the thing about immunity is as we get older, yes, our immunity does decrease, and so a booster is always a good idea. And I informed this person that if you do see a immunization being offered somewhere, certainly go in and get that. A lot of times with infections, we had the scare with Ebola not a long time ago, but several weeks ago. But you know, it's only 4 people, and when you're talking about billions of people, millions of people in America, it's certainly not an epidemic at this point.
Right.
But certainly, if you're concerned, go ahead and get your booster.
And what many people don't understand is with measles, typically you get the MMR, measles, mumps, rubella,
correct,
booster or the immunization, but there are more than one type of measles.
Yeah, absolutely. And just like with the flu vaccine, we try to predict which one is causing most of the infection and target those. Immunizations, again, are not always 100%, but they're pretty good most of the time. Flu vaccine is different from a measles vaccine. It's different from a pneumonia vaccine. So it's all about the technology and the science behind it. Certainly try and offer or get that level of protection if you feel like you are vulnerable. And certainly, yes, as we get older, we are more vulnerable.
All right. This person says, I have times where my vision looks like a kaleidoscope. No colors, just blurry spots. It will last 15 to 20 minutes and not happen again for weeks. Any ideas what it could be?
I would probably think of a migraine headache. They didn't mention any headaches, but certainly you can get that warning that a migraine is about to start. We call that a scotoma or visual scotoma, and that's just the brain telling you you're about to have a migraine. Sometimes it can be related to a migraine but not have the headache. That's a rare form of migraine. Certainly this person needs a good eye examination because there could be something intraocular that could be causing that. Increased pressure, some deterioration of the inner part of the eye, those sorts of things. You never want to mess with the vision, and if you're having vision changes, you need to be evaluated immediately, maybe by an eye doctor, some x-rays of your brain, maybe MRI, blood work obviously, because something obviously is wrong.
Okay, another question. Does your heart ever really heal if you've had congestive heart failure?
It can. There are some reversible causes of heart failure. Sometimes you can get a viral infection that can cause a transient reduction in the heart function, causing heart failure, and after the virus is eliminated by the body and the inflammation goes away, the heart can improve, and so that is a reversible cause of heart failure. For most of us, a lot of it's related to poor circulation, high blood pressure, poorly controlled type 2 diabetes, chronic issues not cured, and a lot of times the heart failure remains. Now the medications we use for heart failure are very good and can improve function, but once you get diagnosed with heart failure, most of the time in these situations you normally have it forever and you have to think about that all the time. But we do have good treatments for heart failure that are always ongoing. That's another area that's getting a lot of money, a lot of attention, because it is a very common issue. There's devices coming out, pacemakers, left ventricular assist devices, all these sorts of really cool things to help the heart function better, including medications.
All right, another question. A 55-year-old female. I just had H1N1. Now she has chronic fatigue syndrome. How can she get rid of it? Bless her heart.
Yeah, chronic fatigue is very tough to diagnose. That normally takes a long time to exclude other causes of chronic fatigue, such as Lyme disease or rheumatological illness. So it's very hard to say right after an H1N1 infection it's chronic fatigue because it hadn't had a chance for it to be chronic yet.
Right.
Normally that's going to take about a few months for it to then turn into a chronic issue, and then excluding all sorts of other things. This person could have a thyroid issue, anemia, could be a medication side effect, could be something else more sinister. So they need a lot of blood work, a lot of x-rays, might even see a few doctors before you can get to a diagnosis eventually of chronic fatigue. And once you get that diagnosis, it's still a very difficult disease to treat.
All right, Dr. Levine, as always, we appreciate you stopping
Yes,
by.
ma'am.
And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kftm.com, or post those questions every Monday on our KFTM News Facebook page.